Now let's talk about inclusion for people living with Down syndrome. Consultant pediatrician Professor John Okeniyi joins us live from Malaysia. Professor Okeniyi, what people do not know, they kind of fear. What do you consider the basic things everyone needs to know about individuals living with Down syndrome?
Good evening. Individuals living with Down syndrome do not have a disease. They are individuals born with an extra chromosome. They are human beings, but because of the extra chromosome, they have some challenges. And these challenges can be addressed with love and compassion and understanding, and they can certainly live a fulfilling and fruitful life. So that is the most important thing I would wish to say as an opener to your question.
Absolutely. Let's talk about how parents should raise them. There are some who would want to isolate them from other children or who would want to take them to specialized schools. What do you advise to be the way forward in this regard?
The way forward is education and more education and more education. It's not to see children who have disabilities as subhuman or subpar. They are human beings with challenges. And parents should be educated. General populace should be educated. In some parts of the world, what people do is when babies are incoming in pregnancies, they do fetal scans, and when they feel these persons, incoming fetuses, have challenges, they stop the pregnancies. Even this is being challenged in modern world now. Allow people live and have their life and live the best they can live, and give everybody compassion and love. If a parent does that to every child and we stop comparing one child with the other, it will start with that at home. As a community, yes, the truth must be said. Children with Down syndrome have some disabilities. They have mental subnormality. Learning may be a challenge, and therefore being in specialized schools, I have no problems with that. In fact, that would be ideal. If everybody has similar problems, then seemingly everybody there will be normal. So nobody will feel stigmatized and things like that. And this will allow every child to be able to reach the maximum of their God-given potential. So that would be a good idea, and government should look into that too.
How accessible is care and treatment for individuals living with Down syndrome, and how do you think government can help?
This is a challenge. This is a big challenge. Healthcare generally is dwindling with numbers of professionals, medical doctors, nurses, counselors, and all that you need, a very holistic picture. Everything is dwindling in this country with a difficult social environment. Let's just put it mildly like that. Security, pay, and the rest of it. So it's getting less and less accessible for persons, not just with Down syndrome, everybody too. Access medical care and all these other social structures. But that still said, we still have tertiary institutions nationwide, government and private places where persons can get to seek help, where information is available. Those who have access to the internet, you can check. For example, this is an annual event that happens every 21st of March. It started 2011. Where information is available. And if a parent has a child with Down syndrome, I first tell them, I don't have Down syndrome and I don't have children with Down syndrome. I may not understand it as much as you, but I am willing and available to go the road with you. I will provide you information. You also provide me information, and we work it out together. So these persons also check on the net. Where I trained in the UK, we had peer groups and support groups where parents came together. It's been challenging. I've had a dream of putting parents together like this, but there's just little that one person or two can do. We
Absolutely.
need government to support this kind of activity as well, to fund it.
It's a good place to leave it now. We look
others.
forward to more of government involvement in this. Consultant pediatrician Professor John Okeniyi, thank you for talking to us tonight.
Thank you very much, and keep up the good work. Thank you.